In today's health headlines, June is Brain Awareness Month. Simple ways to take care of your brain every day. Why early Alzheimer's diagnosis is important and what you can do to lower your risk of Alzheimer's. Joining me is Dr. Carolyn Fredericks, Yale Medicine neurologist specializing in cognitive and behavioral concerns and assistant professor at Yale School of Medicine. Welcome.
Thank you. Thanks so much for having me.
You bet. All right, there are a lot of tips out there for improving overall health, but what can we do to improve or preserve our brain health every day?
There's actually a lot that you can do. There's good evidence that 40% of dementia risk is reversible. Things like not smoking, not having a sedentary lifestyle in midlife, and so getting out there and getting cardiovascular exercise, eating a healthy diet, taking care of things like high blood pressure and high cholesterol early can all really help.
All right, in recent years, there has been an increase in diagnoses of early onset Alzheimer's. Why is early diagnosis so important?
That's right. There has been an increase. And I think to a great extent, we think that's due to more public awareness of the signs and symptoms. And it's actually increasingly important these days because we're at the beginning of a whole new chapter in terms of treatment for these disorders. There are new drugs that are just starting to become available that actually can remove some of the Alzheimer's proteins from the brain. And so far, it seems like the earlier we start those kinds of medications, the better they work. So it's a great time to get any concerns you have checked out by your primary doctor or neurologist.
And it seems like women and minorities are at a higher risk for developing Alzheimer's disease. What can higher risk groups do to help themselves?
That is absolutely true. And I think some of the same principles apply. So we know that for anyone who's concerned about their risk of memory loss later in life, cardiovascular exercise, so half an hour a day of moderate intensity cardio, eating a Mediterranean diet, doing things that are really stimulating for the brain and also social. So anything from social dancing to joining a book club to learning a new language, all of those things really do help keep your brain resilient as you get older.
And what's the latest in the research on this?
Well, I think one of the things that my lab is really interested in is that when people have early onset symptoms, especially of Alzheimer's disease, it doesn't always look like memory difficulties, which is what we tend to associate with Alzheimer's. Oftentimes when the symptoms start earlier, it can look like a problem with language, with getting out your words, or a problem with your spatial reasoning, so your ability to kind of keep the car centered in the road or do a complex maneuver with the car. It's not always about memory. And so I'd encourage anyone who has concerns about their thinking in general to get it checked out early.
All right, good advice. Dr. Carolyn Fredericks, thanks so much for being here.
My pleasure. Take care.